Welcome everyone to Travelers Week. I'm Katie Dashiell. I'm the Content Marketing Manager at Supplemental Healthcare, and today I am joined by two of our recruiting experts from our travel nursing team, and they're going to discuss how to navigate travel nursing right now through COVID-19. So we had some questions that came in before, and we're going to just go back and forth between the two of them and answer some of your top questions. So first, I'll have you guys start out by introducing yourself. So Dan, go ahead.
My name is Dan Smith. I'm a division manager with Supplemental Healthcare. I've been with the company for 5 years. Not only do I run a team of recruiters, but I also do run my own desk as well. So I staff my own nurses and I help people staff nurses. And I love my job.
I am Tyler Pilarski. I am the assistant to the regional manager here at Supplemental Healthcare for one of our divisions. I've been in the staffing industry for about 6 years now. I also have my own book of business that I work with nurses, and I do help other recruiters as well have their own book as well.
Okay, thanks guys, and we'll go ahead and get started. So first question is, what nurse specialties do you think will be in the highest demand this fall?
The nurse specialties we see coming out this fall are going to be ICU, ER, and psych needs are what we're seeing the most. We've seen less of med surg come out across our needs so far, so those are the things that we're seeing from the facilities as of right now.
Okay. Is that a setting where you're seeing a lot more need in, or are there other settings, I guess, that you're seeing more needs during the fall?
So what I am starting to see more in the fall, I just started seeing it. I know originally ER it kind of just disappeared. A lot of people were supposed to stay home, so nobody was going out, nobody was going to the ER, so that kind of disappeared. It's starting to make a comeback. So I'd be on the watch out for that. That might be an up and coming one, but corrections and long-term care are two of the specialties that have been pretty stable throughout everything. The people aren't going anywhere. You're not getting out of jail usually. And if you're in a long-term care facility, you're not moving. So they always need people. So those are the ones that are actually not as volatile, I guess, as the other specialties.
What parts of the country are you seeing the most needs right now?
Right now, COVID contracts talking, pretty much the whole southern East Coast. So Maryland, Carolinas, Georgia, Florida, some Texas, and then California. Those are the big hot spots right now.
So back to you, Dan. How can I stay updated on new needs in real time?
Real-time needs are going to come from your recruiter, in all honesty. To have an open line of communication with any recruiter from Supplemental Healthcare, they're able to update you as they come out. And that's the best place to see them, because a lot of times when they go away, or if they're extensions that are filled, that doesn't get updated on the internet as fast as a recruiter would know.
We're available, most of us 24/7. So if you text us, some people will get responses out to you. So even if you're working at night, always reach out to a professional. Find us online. You can always call into our 1-800 number. You can get in touch with somebody at some point in time.
How do I decide whether or not travel nursing now is right for me?
That is a great question. So there's a lot of different hospitals looking for needs. One thing that I would keep in mind is you have to be flexible with these. They're wanting you to fill a need. They don't want you to come in and, kind of almost set your own schedules. They want you to fill a hole, not have to work around you. So be mindful of that.
Okay, so next up, Dan, what happens if a travel nurse is exposed to COVID-19 and needs to quarantine?
If they're exposed on assignment, that's actually handled right through us. We have a workman's comp. It would be a workman's comp claim, and everything would run right through Supplemental Healthcare. So you would be taken care of from myself, and the managers above me would get on the phone with you that day and make sure that we do everything we need to do to make sure all our nurses are taken care of.
Awesome. So I'll ask you the next question as well, since it's kind of in line with that. What is your policy regarding guaranteed hours?
Guaranteed hours are going to be facility specific. So we do everything we can to make sure we get guaranteed hours put directly in your contract when it comes to where you take the assignment. Some facilities will have clauses in there. Usually it's within, canceled once or twice every 13 weeks. But if it is guaranteed, it will be in your contract. And we do everything to make sure that you are protected. Keep in mind too, these facilities want these nurses to work. So they want you guys to be there. They want you guys to be filling censuses. So that's a huge thing as well.
What resources do you have for coping and supporting your nurses? So I can take that question since it's more on the content end. You can look at our blog. We have a couple different resources for mental health and wellness during this time. It includes external links to free resources during COVID-19 for frontline workers and healthcare professionals. So that's a great resource on the blog that we'll link to after. Next question, Tyler. What can I do now to be ready when jobs in other specialties open up? So kind of clarifying that question is basically, since certain needs are more in demand for COVID-19, for other specialties, what should they be doing in the meantime?
So if you're not in ICU, PCU, step downs, things like that, maybe your mother baby or L&D or home health. Obviously, we didn't have a lot of home health coming out with COVID. People can't go into people's homes. Really, the best thing you can do is get with your recruiter, get a profile filled out, get yourself ready for when those jobs are coming back around. Nobody really has a job right now in those different specialties, or they're not traveling at least. Once they come open, there's going to be a lot of competition. So you want to make sure that you're ready to get submitted right away. So get your profile filled out, your application, send in all of your medical documents so you can get started right away, because these facilities are going to want people to start at the drop of a hat. So yeah, I would say even keep up on your CEUs. And I know certifications were a hard thing to come by at one point. So if your certifications are expiring at some point, make sure you get those re-upped as well. Those are probably the big keys.
Okay. So next question for Dan. Should I extend on my current assignment right now?
That's going to be 100% up to the nurse. I always like to extend, especially if you're in a comfortable position. You have your routine to work mapped out. You have your cup of coffee mapped out. You have your daily routines, when you sleep in between shifts. You have everything mapped out and you're comfortable where you are and you're making good money. Absolutely. If it is something where we do need to move you, I always tell my nurses, give me 4 to 6 weeks. I want to make sure that we're set up for what's next. I want to make sure you're prepared for where you're going. I want to make sure that you don't have any troubles at all when you're going to your next assignment. So extending is always something that is very comfortable. And if you can, I always try to make sure that if my nurses are happy, they stay. But if not, we have what's next for you as well.
Okay, Tyler, what's going on with terms and cancels?
Originally, when COVID first started up in the northern states, it was kind of crazy. They were just trying to get everybody and anybody. So they kind of overstaffed. They got a lot of people they didn't know what to do with, and then they ended up canceling a lot of contracts. We haven't seen that. The southern states have kind of taken note from the northern states, and they're doing shorter term contracts. They're only bringing the people that they need. If the people don't extend for some reason, they only bring that amount of people in. So we haven't really had a ton of cancellations really. So it's not something to fear anymore. But originally back in like March and April, yeah, that happened a lot. So, but that's cleared up.
Well, that's good news then. So I guess as we continue on, still dealing with COVID-19, but things have changed. Dan, what challenges do you see with COVID-19?
You never know where it's going to come next. Staying on top of the curve and making sure that we as an agency do everything to fill these needs for the hospitals and where they're coming next is huge. So as unpredictable as it is, to have things that do happen real time and have that communication with a good agency is really what's most important. Stay ahead of the curve.
What challenges you can face and with getting a contract? I know right now with flu season coming around, a lot of places want it this year. You could decline it at some point in the past. Not all of them will allow that. So if you have a religious or a medical declination, let your recruiter know so we can find hospitals that will accommodate that. Mask fits are really hard to come by too. So make sure that you've had that in the past year. There's not a lot of masks going around, so it's harder to find places to get you set up at. And then lastly, again, certifications. So if you have things that are expiring, make sure that you're staying current on those because classes can be hard to find as well.
Just out of curiosity, for those classes, are they offering more like virtually right now, or is that
So
something?
some of them are, some of them you have to do online and then you have to do the second part in person. I would, if you can, I would always do the online first so you can at least show the facility that you've got half of it done. And then, you know, we can work on finding you a place to do it in person. But half the battle is getting something accomplished. So.
Can you talk about PRN contracts, and are there a supply of these right now?
So we have always had some. We in our travel division don't really do a lot of the PRN contracts. We do have local offices that will handle that. If one thing I will speak on is with the PRN contracts, I know I've spoken to a lot of nurses who are thinking that they're going to get like crazy crisis pay, kind of just like the travel contracts that we have. But facilities actually don't pay as well for PRN as opposed to if you picked up a extra overtime shift at your current job. So it's almost like you're going to be paid the same as your current job. So if you're the only way that it makes sense for a nurse most of the time, not all the time, but is if your facility does not offer extra shift and overtime. And then it would make sense to sign up for PRN. Otherwise, you're probably going to get more pay if you're looking for more pay, just working overtime at your current facility. Then again, with that, working a contract too, you know, it's not, if they have a lot of PRN people, you don't know when you're going to get shifts either. So it's not as reliable.
So that kind of concludes the questions that we had. If you have any questions, feel free to comment on this video and we'll get back to you. We'll also include the contact information for those that were on this call and just our general recruiting line if you do have questions about jobs specifically. For all of our other resources and other free sessions like this for travel nursing and travel healthcare, go to healthcaretravelersweek.com. Thanks, guys.